Okay, great. So we're moving now to the shoulder joint. Now, the shoulder joint again is a fantastic joint for mobilization. However, my approach to that mobilization is a little bit different, and I'll show you what other schools mostly teach or concern about, and then what's my concern about. So first of all, in terms of draping, you're taking the towel this way. Now, can I ask the camera to come a little bit close this way? Because next what I'm going to do is to show you what the shoulder mobilization can means. First of all, it can be the movement of the humerus on the scapula. And that's that movement, right? Which movement is that one?
Abduction.
Abduction. This one is.
Adduction.
This one is flexion.
Extension. Supination.
Nope.
Oh. Rotation.
Rotation. This is internal rotation, and this is external rotation. And this movement,
Circumduction.
circumduction. So these are all the movement of the shoulder joint. Now, usually what happened, and I'm not talking about physio or osteopathy treatment, but in massage, that the shoulder joint movement is okay. What do I mean okay? The joint itself rarely has arthritis. You have condition like frozen shoulders, you have condition like arthritis, rheumatoid arthritis, gouts, you have sport injury to the shoulder joint. It is there, but for what we're learning in that course, I would say that you need very little of that pure movement for mobilization. Because most people will have it. Now, there is, however, another movement that to the majority of our client doesn't work well. And that's mostly the scapular movement. Yeah? So, scapular movement is that movement. How do we call that movement? Depression, protraction, retraction. Okay? So can you do it again? Elevation, depression, protraction, and retraction. Okay. So most of our clients, what sort of position of the scapula they will come? They will come with a scapula elevated or depressed? Elevated and protracted. So what we need to do actually is the opposite. We need to take the shoulder blade backward and downward to stretch more that area. Okay? So let's think about which muscle attached to that area. Okay? Start with trapezius. What else? Levator scapula. Good. What's on the
Rhomboids.
yes, rhomboids. Yeah, good.
Oh, the
rhomboids.
supraspinatus.
And supraspinatus on top. Deltoid. Yeah. Okay. And there are teres major and teres minor. Yeah, but let's say, okay, these are the muscles. So when you do that at home, I would suggest you to look at the anatomy book before you're starting to see where the muscles starting and ending. So you can really, when you're massaging, you can really look at them. Okay? So again, that's the difference between this movement and that movement. We are more concerned about that movement and that one. Not so much. Yes, we will use sometimes that movement also, but not much. So far, so good? Mm-hmm. Now, let's talk about holding that arm. If you want the client to relax, as we look at the neck, you need to be very supportive. So the worst would be kind of taking two fingers, and your usual client wouldn't allow you to do that. They will hold it. They will hold it because they wouldn't feel supported. Yeah. So I'm going to teach you what called 3 attachment position. And it's always work like a triangle. When you have 3 position of attachment, the structure would be stronger. So here, this would be like 1 attachment position. So the 3 attachment position, maybe come to the other side, even with the camera, would be as such. This is a 1 position. So it's between my waist and her forearm. The second one is with my forearm. So do you see there is a sandwich? And what I can do, starting, is to just move her arm that way. Now at the beginning, you all will be like that. But slowly I want you to relax also. Yeah, you need to put, it's like a Scottish flute. How do you call it?
Bagpipe.
Okay. Do you know what I mean?
Yeah.
Yeah? When you need to kind of push it to inflate air, but you don't want to do it too much. Okay? Good. So the third one, once you're okay with, I want you to just walk upward. Good. And even, do you see the traction here you can do? Yeah. I'm just moving my body backward. Yeah. The third position is my hand on the arm. So this is 1, this is 2, and this is the third position. Now in this position they feel a lot more supported. So they would allow you to start moving it. That's what I want you to practice now. There would be a tendency of their arm to be locked. Try to bend it a little bit. How? You're just moving your body this way. And then, from there, after that, you kind of go around. But what I want you to feel is that you are supporting it well, and you can move the arm without any problem. And it's actually your body. If you start doing that, not good. Nothing happened between me and her body. It's only my legs move. Yeah? And you can then go this way, come to here. Yeah? Okay. Let's work just on that. It looks easy, but good. So far, we've just talked about how to hold their hand in a way that allows them to relax. Yeah? Now, let's talk a bit about, remember we talked about the cultural context of the modern lifestyle where everybody's shoulders forward and upward. Now, what you want to do is again talk to the brain and teach the brain how to actually relax, because this upper trapezius tension is so common that there is even a named pathology for it. It's called trapezius myalgia. What is myo? Muscle. Trapezius myalgia is pain in the trapezius muscle. And a lot of your clients who will come with tension headache, shoulder pain, neck pain, tension there, feeling even sometimes a bit dizzy, a bit run down, would come with tension there. So a lot of the regular massage treatment would be effleurage, petrissage there, compression, even elbow, but sometimes you need to be a bit more educative to the nervous system. You need really to educate the nervous system what relaxation is. And it's interesting because some of my clients, they would come with that kind of pain, and then we would work, and then they start feeling better, and then after that they coming and saying, I start feeling tension when I work on the computer. And I've said, that's great. It's really great, because now you start feeling where the problem originates from. So I think the home take message is that problems occur because we're doing something not right. So you're trying to teach the nervous system by how to move without tension to move in a better way. So let's take it into practice, right? So you are holding the shoulder and you're looking now at the trapezius muscle, yeah? So what you can do to help it, first you can rotate the head to the other side. Now you start doing more the scapular mobilization. You're putting one hand here and then you start moving. And you are actually massaging together with mobilization. So you're putting the shoulder up, and by then you're putting the upper trapezius in a lock position. Maybe the camera can go even higher to just show that, yeah? 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 So this is stretch. This is where the muscle locks. And this is where you can massaging in here, and then again stretch it. And then lax it, and then massaging it. Now I'll tell you how would it be looking at. Can I have another towel, please? Yeah, good. So imagine that this is the, hold it with me. This would be like the muscle, yes, the trapezius muscle. Now if it's tense, remember what happened to the fluid around here? No fluid, lactic acid accumulation. So you can massage that muscle, but what I'm doing now, I'm putting the muscle into lax and then massage it. And then stretch it. And then again lax it. And then again stretch it. And then effleurage, and then petrissage, and then compression, and again lax it. Yeah? So let's have a look and see, thank you. Let's have a look and see in reality how it looks like. So again, you stretch the muscle, and then you lax it. And when you lax it, you can work deeper into it. You can even put a bit of compression there. Maybe come around to here so you can see it from that position. Yeah, good. Stretching it. Laxing it. Even taking it really high, and you actually, by that, allowing the fiber to get softer, and then you stretch it again. Now, some of the client would be very hard for them to let go, and this is exactly the client that would be best to give them that treatment, when that is hard for them. Yeah. When this kind of treatment would be hard for them, because they would feel that they anticipate, they not relaxing, they helping you. These are the clients that forgot what relaxation is, and that's where you need more of this. Yeah. Okay. Then you can even take it further to bring it around across to here. And then put your hand into here, and then try in a different way. Push it this way, and lax it. Again, push it this way, and lax it. Just this one. Any question?